Okay, everyone, it looks like we're just about ready to get started. Thank you all for pinning yourselves on our map. I'm going to change the screen right quick. One moment, please. There we go. Okay, we're just about ready to get started. Before we do, for those of you who may be new to Adobe Connect, I just wanted to share a few housekeeping tips. Please continue to use the chat pod on the left side of your screen if you have any questions or would like to share resources. The number to dial in is in the events note pod at the top of your screen. We are recording today's session, and we will let you know as soon as it is available. And also, because we have a number of presenters today and we're looking for engaging conversation, all of the participants have been muted, so we will be able to hear our presenters only. Next, if you'd like, a copy of today's presentation is available for download in the presentation pod in the lower left-hand side of your screen. If you're having trouble downloading it, please don't worry. We'll send it to you after today's presentation. And that's enough for me. At this time, I'm very pleased to turn the reins over to my NCASE colleague, Mr. Tony Strait. Tony.
Well, thank you so much, Preeti, and welcome to everyone. Good afternoon. We really appreciate you being with us today. I am the principal investigator for the National Center on Afterschool and Summer Enrichment, and we're very thrilled to be hosting this conversation today on the state of school age. We have guests from a number of leading organizations, and we have folks from Office of Child Care as well. Let me just quickly share the goals for today, and this meeting has been in the works for some time. We thought it was important as a field of school age care to be addressing all of the challenges that we're facing. And certainly this summer has been a test of how effectively school age care can continue given the pandemic and the significant issues that parents and providers are dealing with at this time. And we thought we would do that by inviting speakers from summer learning to really talk about what they've experienced and what they're dealing with at this critical time. So as you can see on our screen here, we have 3 guests from leading national organizations on summer learning and out of school time. Jen Reinhardt from the Afterschool Alliance, Henry DeHart from the American Camp Association, and Aaron Dworkin from the National Summer Learning Association, NSLA, who is actually one of the partners to NCASE. We'll also be hearing from my colleague, Dr. Katari Coleman, who is the project director for NCASE. And then after these brief presentations, Shannon Christian, who's the director of the Office of Child Care at the Administration for Children and Family, will be offering a response and helping us kick off what we hope will be a compelling discussion about the new school year and the fall and how we hope to support the school age care field in the year ahead. So let's get started. And again, Dr. Katari Coleman of NCASE is going to share just briefly a most recent development from NCASE with all of you. Katari?
Yes, good afternoon, everyone. NCASE develops numerous resources and provides several training and technical assistance offerings each year. One of NCASE's hallmark resources is the annual publishing of the Child Care and Development Fund Lead Agency Data Profiles. These profiles provide information we gather on how many school-age children are served through subsidies and where they're served. and track state policies and practices that can promote access to school-age childcare. Our newest data profiles using fiscal year 2018 data, the most recent available data, are hot off the press and are posted to the NCASE website. In fiscal year 2018, an average of 584,000 school-age children were served through subsidies each month. 3/4 of those children were served in centers, with slightly under 1/4 served in family child care programs. The remaining children were served in their own homes. Note that because the most recent Child Care and Development Fund enrollment data are from fiscal year 2018, we do not yet know what the numbers look like for this year given school and child care closures. That is, we want to invite you to go and look at those new data profiles to give you an idea of the usage of subsidies across the nation or in your specific state or territory from fiscal year 18. And I'm going to turn this back over to Tony.
Thanks, Katari. And it may be hard to see from the slide there, but always compelling to note that summer is historically a time for CCDF when there's an increased service to children around the country. It varies some by state, but we've always tracked a bump in care that goes on because of the needs during the summer months. So moving forward, I'd like now to introduce Jen Reinhardt from the Afterschool Alliance. They've been doing really some critical work this summer on measuring the impact of COVID and how providers are attempting to serve the field. And Jen, if you could share some of your latest lessons learned.
All right, great. Thanks, Tony. Thank you for organizing this conversation and for giving the Afterschool Alliance an opportunity to share some of what we've learned over the last 6 months. Like all of you, we've definitely seen a growing recognition of the importance of school-age care and the role of afterschool and summer providers since the pandemic started. I want to really emphasize the importance of coordination, and I'm sure those of you working at the local level have seen this play out. As many schools are moving to hybrid and fully virtual models for fall reopening, it's really critical that we all work together to figure out how to best meet the needs of young people and ensure that they have safe places to learn and opportunities to grow academically, socially, and emotionally, all while making sure their health is, of course, our #1 priority. And for our policymakers and funders, we've really been emphasizing the need for flexibility. We need policies that allow communities to adapt to current context quickly. I think we're all feeling like the only thing that's certain right now is that there's a lot of uncertainty, right? And that things are very fluid and move very quickly in terms of changes in plans moving forward. So with all of that fluidity and state reopening plans and school reopening plans and so much more, every time those changes happen, different needs have to be prioritized in communities and by school-age providers. And providers can't wait for new legislation or new guidance when families urgently need care and support. We know that after-school and summer providers across the nation have figured out how to operate safely and how to meet families' needs. We've seen this happening through care for essential workers, through distributing meals, offering technology, delivering learning kits, offering virtual check-ins with young people and enrichment, and doing both virtual and in-person summer programs. We're not just relying on anecdotal stories of providers. We have data that show that school-age, after-school, and summer programs are really rising to the moment to meet the needs of kids and families. So you can see some links here to resources that are available, and the PowerPoint is available to all of you, so you could click through those links too. I want to just emphasize that we do have a new wave of data collection happening now, and I'll come back to that link again at the end, but we'll talk about a couple of the key findings first. When we surveyed providers back in June, we were looking to get information from them about how they were operating during the spring and what they were planning for summer. And what you can see here is throughout the month of June, we heard that 7 out of 10 providers were able to serve students in some capacity. So many people had this impression that when schools shut down, that childcare and after-school and summer programs shut down too, and that is certainly not the case based on the data that we have, with a large majority of programs actually continuing to provide services, and particularly in communities that are predominantly low income, we really see providers stepping up to meet those needs. Of course, concerns about young people are really the top of mind for providers and are what are getting them to be in this innovative mode, right, and figure out innovative ways to meet community needs. But providers are also concerned about their own future, with this vast majority of respondents saying that they're concerned they won't be able to provide services in person or virtually this fall. So they're optimistic, I would say, but they're also nervous, right? They're hopeful about the future, but worried about what might happen. And I'm seeing a little question in the chat. I'll just say this was about nearly 1,000 programs that responded to the survey. They represented about 6,000 individual program sites, and we do have a data dashboard on our website that you can filter the data by region, but you can't do it by individual states. So, of course, some of the challenges as we look forward, and many of you who are providers, these will ring very true for you. Of course, we're looking towards longer hours being likely, especially for these virtual and hybrid schools. After-school programs needing more space, or perhaps even different space if they don't have access to the space that they had before, needing more staff to meet the new ratios, and of course needing more funding to be able to do that. And so one of our key points is that we need all of the funding streams that support after school and summer to be as flexible as possible, whether that's 21st century, that's childcare dollars, or that's meals. And that in many cases, we think agency guidance can really help do that. In particular for childcare, for CCDBG, we are calling for guidance that really helps offer flexibility regarding hours of operation. So redefining what regular school day is, since nothing is regular these days. Also figuring out ways to get funding to license exempt programs, and we know some states who have been trying to figure that out. Because people are having to move into this new space that they've never used before, helping to break down some of the delays in getting funding to programs, and also, of course, additional supports to help keep staff and young people safe while they are in programs. Oops, I went a little too fast there. So I just want to point out some resources that we have available on our website. There's a whole set of tools around reopening programs and tools for outreach to school districts to have these conversations about really how to collaborate and work together with community partners. So I encourage you to take a few minutes to check those resources out. And then just leaving with a few things you can do. One, of course, is share your stories. Help us, help Office of Child Care, and other federal agencies and policymakers really understand your challenges and successes, so we can try and make sure that policy really reflects what you're trying to do and is supportive of that. And then, of course, as I've mentioned already, take a few minutes to complete that wave 2 of our provider survey, which is asking you for information about what you are able to do over the summer, or what you were able to do over the summer, and also what you're planning to do for fall, given what you know now about your school's reopening scenarios. So that's it for me.
Thank you so much, Jen. And our next speaker is Henry DeHart from the American Camp Association. ACA, really from the onset of the summer and beforehand, took the lead in helping the field think about reopening for the summer, about how to safely bring children together at this time. And so we've asked Henry to share some of his observations about how their membership has handled the summer to date, and what lessons learned we should be thinking about at this moment. Henry?
Great. Thank you very much, and thank you for having us here for this important conversation. So yes, as just laid out there, we were hoping that we could share a little bit of our journey through the summer and what we've learned as we're thinking about the school year that's ahead of us. So let me start by saying we have a variety of resources available free to anybody, whether you're connected to ACA or not, on our website. If you see this is the homepage of our website, that little red button at the top, we have a COVID Resource Center. And one of the central pieces of that is our field guide for operations that we created with camps in mind, although it has been, I think that a number of organizations that are in the youth development space have been referencing that as well. Using our experience with H1N1, we knew that once guidance came down from the CDC, camps were going to need a lot of support in a little more tactical detail on how you operationalize that guidance. So we engaged an environmental health consulting firm out of Boston. They convened a panel of experts and created this field guide, which is a roadmap for implementing in-person programs with youth. So we have these strategies that are a part of the field guide, and they're based on the CDC guidance and other resources that are available. Let me start at the high level. Overall, the picture with camp this summer is very positive. While many camps were not able to operate or chose not to operate during the summer, there are a significant number of camps that did operate. And our conservative estimates, we don't have a final number on this, is that more than 3,000 camps did operate, both day and overnight camps. It's likely that the number is higher than that. And you wouldn't believe it by reading the news or watching the TV, but the picture has been very positive overall. With more than 3,000 camps operating, there are less than 100 instances of coronavirus in camp that we're aware of, and we're probably not aware of all of them, but we have been monitoring heavily and probably are aware of most of them. That's a lower number than we expected. Our medical experts on the EH&E panel, the CDC, other people in this space have said from the very beginning that it's probably not likely we're keeping coronavirus out of camp. It's a matter of mitigating the spread and putting protections in place to the best as possible. And so we are not surprised there was some coronavirus at camp, but it was less than what we expected, and we attribute some of that to these strategies. And of the less than 100 cases of coronavirus, a minority of those were wide outbreaks. And I know here in the last couple of weeks there have been a couple of those in the news. It has happened at some camps, but the majority of instances of coronavirus have been single instances that were quickly identified, isolated from the community, and the strategies prevented widespread, which was exactly why the strategies were set up. So overall, that news is positive. We do have a number of research initiatives that will begin as soon as the summer season officially ends for camp so that we can get tight data around that, and we'll be sharing that story widely with folks, so be on the lookout for that. So what we have learned, and again, this is based on the conversations and interviews we've had with camps that have operated that did not have an outbreak or an instance, and those that did. And so these are the themes from these conversations. Again, one of our research projects will be to go tight into those details and find out exactly which strategies work the best, where were their challenges. But we do have good themes that we're confident in on what strategies worked. And I think the overall theme from camp is that it takes layers of protection. So our strategies have multiple layers of protection that are involved, and they work best when you employ all of them. And where we have seen gaps, where we have seen wider outbreaks, it's either that camps were not implementing the strategies or they were implementing some but not all of the strategies. And so one of the themes is that using all of these strategies in conjunction decreases risk. And so that's a big learning. Of the central strategies that we have discovered, I'll go through a couple of those real quickly, and then, if there are other details we can share later in the presentation, we can do that. So we have found that it's very valuable to do a pre-screening before people showed up to the program. And While that is clearly and logically a benefit in overnight camp, we also showed that it was a benefit in day camp, even though children and staff were going home every night for a couple of reasons. One is it got people in the mindset of monitoring, and potentially people altered behavior prior to camp because they were excited to go to camp. But we actually, many camps asked their participants to do 14 days of temperature checks and reviewing questions about symptoms or exposures prior to camp, and then had a sheet that they could turn in beforehand. So pre-screening before camp, part of the benefit of that is that you are catching any instances before they come to the environment. But the other part is that it begins to seed the culture and the expectations for the experience. So this is another strategy that we found was very important, is that people who attend camp often attend for multiple years, and it's a welcoming and warm place, and people are very excited to see their friends at camp and often run up and have hugs and high fives and other ways to greet each other. And we found very early on that you had to, with staff and with campers, set the expectation before the program began that we're still a welcoming and warm place, but we're going to greet each other a little differently. And camps had creative ways to do that. There were clearly air hugs and air fives, but lots of camps came up with creative ways. But the important thing there is helping to establish the expectation before you ever walk into the program area. So that's the second strategy that was very important. A blending of masks, distancing, and cohorting. And so I'm sure everybody's heard a lot about the strategy of putting individuals in small cohorts and as much as possible keeping them in that cohort all day long, and then distancing between the cohorts that you have at camp. That is a very effective strategy. It is most effective when it is also paired with appropriate masking and social distancing. And so we have all read that, and our experience bears out, outside is at a lower risk than inside. So when we had cohorts inside, they may wear masks even if they were only with their cohort. If you have multiple cohorts in a similar space, certainly we were masking, and you were distancing as much as possible within that. So that blending of masking, distancing, and cohorting. And the cohorting was really valuable when there were instances of coronavirus, in that you could quickly isolate the individual and give them the appropriate care, but your contact tracing was built into your program design. And so that was important. Of course, heightened hygiene, hand washing, not sharing of equipment, whenever possible having individual equipment for each camper assigned through the period of the program. That was easier if it was crayons or something like that. It was harder if it was archery bows that had to be shared, but then you had to certainly had to sanitize between uses. And so those are the broad strokes. And the last one that I will say is having a strong relationship with your local health department and health officer, letting them know your plans, letting them know your protocols you're putting in place, letting them know your plan if there is a suspected instance or an instance, and allowing them to help influence those plans, as they are the ultimate authority in that area. And so we did encourage strong relationships with your local health officer. And so big things are, overall, the strategies have been successful, but that does not mean that coronavirus hasn't shown up, that culture is important, that layers of strategy together are the best way to protect the community. And then there are lots of other strategies we can go into, but those are the broad strokes. So I'll stop there. I know other people have information to share, and I'm available to be a reference later in the call if needed. Thank you.
That's great, Henry. Thanks so much. Just two things really quick. In the chat, we did see a question for clarification. You had said that there were a number of cases. Were those both children and staff, or just children?
It was a blend of both. So there were some instances that were staff before the children showed up. Some instances were both, and then some instances where it was just a child. And again, the majority of those were just single instances that were identified, isolated, And so that was both staff or camper. We did see instances in campers as well as staff.
Great. And then you said there were about 3,000 camps open. Do you have some sense of what percentage that is of nationwide in terms of open?
So again, a conservative estimate, it's kind of hard to measure camps because lots of people call things camps without a tight definition. We estimate there are at least 15,000 camps across the country. Real quickly, our estimates are that only about 18% of overnight camps ran core programs at all, and probably close to 60% of day camps ran core programs. All of the programs that ran at a shorter calendar, but also at significantly reduced capacity. And part of that's a part of the strategy in allowing the room to distance. And as we think about school-type settings, I know we've already referenced having room to spread out was an important strategy as well. So hopefully that helps with the numbers a bit.
Thanks so much, Henry. So next up, we have Erin Dworkin, who is the Executive Director of the National Summer Learning Association. And they've really been tracking also the impact on summer learning, and particularly what it's meant for families and children and providers. And so we asked Erin to just share for a few minutes what they're learning. Erin, are you there? We'll give Erin just a second here. There may be an audio issue. Preeti, can you confirm that we have Erin on the line?
Hi,
Tony,
yes,
we need a phone
Go
number. We need the last 4 digits of his phone number so we can unmute him. We need him to put that
Erin,
in the presenter chat.
Hopefully you heard that. If you could share the last 4 digits of the number you dialed in with, then we can unmute your phone. Looks like we have the lucky number 1835. And once you have that, Erin, if you could turn on your webcam, then you can proceed with your slides. We're still not hearing you, Erin. Go ahead, Preeti.
No, thank you. Would you also be so kind as to provide your area code? We have a lot of phone numbers, and I promise you we'll get you in right away.
Hello?
All right.
Hello, everyone? Okay.
There he is. Thank you, Erin.
All right. Apologize for that, but thank you. I will say that this is the most secure webinar meeting I've ever been on, so thank you for that. But I want to, first of all, thank you, OTC. Thank you, Tony and NCASE. Honored to work with you and all our partners, obviously all the school-age care provider groups that we have on, the Afterschool Alliance, a longtime partner, Jen, and then Henry and American Camp Association, with whom I work very closely. So it feels like a family gathering on this call. Hopefully many of you know about NSLA. We've been around for more than 25 years, very focused on closing academic achievement and opportunity gaps over the summer months. Our website that has a lot more resources than I'll be able to get into right now is just summerlearning.org. We have a lot for COVID and a lot of best practices and webinars and blogs that we can share from best practices we've been collecting around the country. But I'd like to just share some of what we've learned from working and supporting so many thousands of partners across the country. Go on the next slide. So just real fast, so many of you are doing this work, so you know, I'll just emphasize that I believe that summer, the things that we care about summer are being applied to this COVID context, and we're seeing a lot of it. And it's, you know, there's a lot of doom and gloom, but there's a lot of wonderful kind of silver linings taking place here. And we always say that there are 4 eyes of summer, you know, that it's a time for improvement, both for students to keep learning, but adults, when you think about all the professional development that happens over the summer, time for innovation, which we'll talk about, and we're seeing so much of, during this COVID experience. Integration, and that's this kind of breaking down of silos in education and sectors, and we're seeing so many people working together and reaching out to one another and communicating. I know our organization's been on more calls with new allies and partners than we've ever been in the last few months, and it's been great. We hope to see a legacy from this time. And then obviously impact, and there's going to be a lot of data, but there might be a lot of change that comes about from this experience that maybe change how we do digital learning, how we do blended learning, hands-on learning, all these different experiences, how we build our partnerships and be thoughtful about them in an intentional way instead of a reactive way. So there's a lot we could share, but those are like 4 keys that we're seeing a lot. And we'll go, if you go to the next slide. So just to say that we've had, since COVID started, probably webinars with almost 6,000 people participating, a lot of programs, school districts, nonprofits, government agency-run programs. A lot of corporations have gotten involved trying to create resources for our space and our field and families. So it's just been really, very positive to see. But this is what we do know, and I think all of us have seen this, and that, what's going on. There was a huge rush to get online learning going. Some people did it well. A lot of people really struggled. A lot of families struggled. And not only do you have devices, but do you have internet access? And especially when you talk about low-income families and rural families. And then how do you do it in an engaging way? And that's been a huge theme of all the partner groups that we've been working with. Yeah, it's one thing to throw curriculum online, but can you keep people's attention, or even if they show up, and what does classroom management look like online, and all these different activities. So there's a lot to be learned that I think we're trying to collect, and that's going to be still necessary to apply and improve upon in the fall. Another big issue area, and we've been working, and I know we're talking about surveys that are going out. We're partnering with Bill Noam of the Harvard Pear Institute on a mental health survey, and obviously it's a traumatic time for some. He would recommend we don't use that word because it's been difficult for most, but traumatic for some for sure, and not for all. But we still know, and he believes, and his expectation is that the number of young people who require, mental health interventions and services is going to increase. He says in a normal year, 13 to 20%. In a regular year, and then going back, looking at other times of challenging times, past natural disasters and war, and go back 100 years, the numbers that they're using is that they expect the number to go up to almost 30% students in need, professional mental health intervention. So we need to really be thinking about how do we support our students with what they're going through right now. On issues of educational equity, which I know we all care about, I think one thing that we're seeing that's interesting is, and then also we should acknowledge all the social and racial justice issues that have come to the forefront during this time as well, that our students and families and staff are all well aware of. But in addition, if you've been following some of these articles and practices about what I'm calling moving goalposts, we're trying to create more equity, but at the same time, if you're a upper middle class family with more resources, and it's not one-off. You're creating pods. You're hiring teachers, certified teachers, to come to your home and work with your students in the backyard. And there's going to be this whole tutoring cottage industry going on here that will just exacerbate the gaps that we've all been working so hard to close. And then, with ACA and Henry and Tom Rosenberg's great leadership, really educating so many of us about what to do in a health crisis and what are these new safety practices we need to put in place. So go to the next slide. So again, we can run down. We have lots of examples I'm happy to share offline and follow up with anyone who's on this call. But I think some of the lessons that we've also learned here is that, real world relationships still matter. And again, that's so much core to our work and having caring youth adult relationships and finding ways to do that still, so it's not feeling so anonymous and digital. That there's the high tech and the low tech. That we've seen so many great examples of school districts and partners and governments and municipalities who have school buses that are dropping off meals and dropping off homework packets, and that's not a digital way to connect, and caravans going by to keep students engaged and know that people see them and love them. I think it's a time to be hyper empathetic and to really, there's so many things that we can't even foresee the challenges between the unemployment being so high and again, the health, and so many 150,000 people dying, and the impact, and getting more being sick. So understanding what people are going through and really trying to reach out and understand and be supportive. A need to be local and connecting community assets and resources and leaders that we have on this call. We're able to connect the dots. We've talked about the creativity that's necessary, and there's this great blending and blurring where now time is not necessarily the biggest challenge, where we have, you know, the opportunity to have summer programs to keep going, after school programs to go during different hours, and we're working with districts who have different schedules. And then, as we're saying, the chance to be as collaborative and communicative that we're seeing. So if you go to the next slide. Just the last thing I'll just say is about all the resources again. And one thing that we've tried to do is put every resource that we have, but also to collect all these wonderful resources that are being created. And we created a national task force that is coming out with a playbook that lists a lot of resources from other groups so you can get them all in one place. And we'll share that with everyone. That's coming out soon. But there's been so much created. And again, any support we can provide from lessons learned from these our groups. We're doing the surveys with the Alliance, teaming up with Harvard, and hopefully even ACA and others. So we're trying to cut data from this and keep an eye on summer 2021, because that summer is going to be more important than ever as we respond to the moment we're in. Thank you.
Thank you so much, Aaron, and we'll draw you back in as we get into the discussion portion. But at this point, I'd like to invite Shannon Christian, the Director of the Office of Child Care, to join us both on the line and via video, and share a bit of a response to what we've heard so far from our colleagues at the national level. Hi, Shannon.
Hi, Tony, and all of you. This has been great so far. I want to thank all three speakers for being quite succinct and meaty, and most of what you're sharing are things we had heard about in some way, but maybe results are a little more positive than we had heard, so that is encouraging. I thought I might just say a little bit about how we've been spending some of our time, and then we can open it up for discussion that goes back and forth between all the different players. We at the Office of Child Care have been spending time thinking and helping grantees understand the flexibilities that are in the CCDF, or some call it CCDBG, the two funding streams that come together to become CCDF, as well as the new CARES money that was put out, this extra $3.5 billion in supplemental funding that was supposed to actually support the emergency worker families' child care needs, and also help sustain the general child care market, which was new. And then we've been processing a lot of waiver requests and plan amendments that when states couldn't do business or other grantees the usual way and they wanted to exercise some of that flexibility, there was some paperwork that went with that to make sure that was all right. Then in addition to that, knowing that Congress is talking about different ideas and ways of getting money into the schools and child care and more related to the issues you're talking about, we've been thinking about how any new money that is put out may need different kinds of technical assistance than we have provided before. And that would also include supporting the general child care market, not just subsidized children, which we've always done to some extent through the dollars that we get that are to support quality activities across the whole child care market, but we haven't ever been put in the position of thinking about how the money that comes through the Child Care and Development Fund might go out to sustain the private market in general. And the reason that has become such an issue, as you all, I imagine, know, is there are all these uncertainties around supply and demand, and anticipating the impact of the changed business model for child care with the new safety policies and practices that the CDC asked about and that you've been talking about experiencing over the summer. You're serving fewer children, taking in fewer dollars, but maybe your fixed costs are the same and some of your fluctuating costs are higher because you've got extra cleaning going on and a lot of that. And what used to be your business model doesn't work right now. And so thinking about what kind of supports may be needed and how and for how long, what intensity and how they vary across the country and what are the pieces that influence that. And then, so that's big. But we are also really interested in how the communication occurs across the whole group of partners that are needed to develop solutions that go beyond the silos that we all got used to. And I noticed several of you mentioning communication and seeing people coming together, and I'd like to know more about how that coming together of different players that don't usually have to do this as in sync is happening. How does it get started? How is it sustained? That's something I'd like to hear your insights about, because we aren't seeing quite what we would have expected around that given the pending school schedules that may really put a much different and larger demand on the child care system. So I'd be interested in how you got those conversations started. And there are a couple of frames that we're trying to make sure everyone thinks using, and what that is, making sure everyone's thinking about the babies, the toddlers, all the way up through at least age 12. So that's the group that we cover, and the ones that are not likely to be able to stay home alone. And then, so that broad set of ages, and then again, thinking about the subsidized children and the unsubsidized children as a routine thing, not like an extra little add-on, but fundamental to this work. So that's where our thinking is. It aligns with what you've been thinking, but I think we're about to hit something where we have to scale up a whole lot fast. And so that's where my thinking is. So I will turn it back to Tony, and you may start your conversation.
Thanks, Shannon. So stay right there. Let's, Prite, if you can take out the PowerPoint, and then speakers, if you can come back in via your webcams, we'll start the conversation. For those of you who are viewing and listening in, this is your chance to add comments or questions in the chat, so feel free to offer any prompts to any of the speakers. But maybe we could start, Shannon, with your first question around partnership and coordination at the local and state level. Jen and Henry and Aaron, are you seeing that underway, and what is it going to take? What will those partnerships be like?
Yeah, so I can jump in and start things off. I think one of the key drivers in some of those conversations that we've seen are the statewide after-school networks, who have really been bringing together some of the key agencies and trying to get folks from their state Department of Education, talking to their state child care agency, and even workforce boards and others, like trying to figure out kind of this nexus of people have to return to work in many places, right? Like working from home is not an option for many, many Americans. And how do we make sure that in those school reopening scenarios that those children have access then to safe places to go to do their virtual schooling and have the supportive adults surrounding them. So the networks, I think, have been big players in trying to bring those partners together at the state level. We've also heard just locally that, kind of challenging times force people into innovative approaches, right? And superintendents are reaching out to providers, and providers are reaching out to superintendents. Those conversations are happening. They're not happening enough, but we definitely are seeing them and are beginning to collect those stories and talk about them. And we have a whole suite of tools on our website that are really designed to help support those kinds of conversations and that kind of outreach from providers to districts, and also tools for providers to give to parents to use to make sure that parent needs are being heard in communities too. So I'll stop there.
That's great.
Maybe
that
Aaron,
corporate piece. Maybe you'll tell us that the corporate piece you're hearing, the interest from business, as well as whatever you were going to say.
Sure. No, I mean, I'll just echo Jen, and I agree. Thank you. They've come to such great guidance, and I encourage everyone to look at. I think the state after-school network, like she mentioned, there's a lot of task forces that have been created, in general in different states that have been trying to bring kind of multi-sector stakeholders together. And when we talk about being collaborative, we're saying that. I think there is a concern with the school districts being so overwhelmed with their planning. How do you get on their radar and get on their agenda and find time? They want help. They know it. They're just trying to think, what's going to happen next week and in 2 weeks and 3 weeks, and they have so much to do. So whoever is the best person to pull those stakeholders together. So I think, first of all, governors. We're seeing a lot, state education agencies. You get down to the municipality level. Mayors have the chance to bring a lot of government agencies together to work together. And then I also, when you talk about the private sector, I think chambers of commerce, and I've heard, Jody Grant mention them. We're encouraging people to reach out to them. You have a lot of, you saw this with the example on the digital divide issue. People, where can we get laptops? Well, you have thousands of companies that no one's allowed to go to their offices right now, and no one's using their computers. They're happy to donate, or they've had to downsize. So this is where we need, when we talk about creative, connecting the dots, problem solving, other people, and we saw, a lot of examples on that. So I'll stop there, but it's multi-sector, and then it's within education, getting the camps, the after school, and the school system all partnering as well.
And all the way down to the providers themselves, right? Everybody.
Absolutely.
Yeah, so I might just add just briefly that, the American Camp Association being a part of this conversation is a great example of the partnerships that are happening, and the fact that we've been able to share some of the resources we developed, given the fact that we were doing in-person youth programming months ahead of some other people has been really great, and we've been leaning into that. And so, that's great to see, and it kind of lifts the whole. Camps are trying to be creative and trying to figure out how to support schools if schools are going virtual, and you have to have childcare, and there's some really creative ideas going on out there. The challenge is some of the more worn structures are harder to adapt to this, and the biggest place that lands is around access. So the camps that are being creative, clearly there's got to be some sort of revenue that comes from that. And without a funding channel to get funding to help support that type of educational support, it ends up limiting access to those who probably could use it most. There are many camps that are in areas where they could be in support of schools. We have camps in urban areas, even though that's not the picture that goes to folks' heads. So I think that we recognize that, and we're trying to do what we can to be creative around that. In the quick time frame with the school systems as overwhelmed as they are, we also recognize there'll probably be limited progress, at least for the early fall, but maybe this is a conversation that lasts well beyond this. So I'd add that as well.
Thanks, Henry. Shannon, there's been a couple different questions in the chat around an issue I know we've been talking about in terms of if schools are virtual, how can CCDF and other funds be used, and the concern about duplication, that child care dollars are not supposed to pay for school time. Is there any guidance that we can share at this point with people?
We're going to have something out pretty soon, but our expectation is that we will interpret it the way we have before and what's in the law now, unless there are changes in the upcoming legislation somehow that we didn't anticipate, that as long as you're not replacing school, like, being the one delivering the education, that child care can supervise those and provide care for those distant learners if the state CCDF administrator and the policy of the state is to do that, and they can maybe prioritize different groups. They might say those that don't have the choice to go back to school, if funds are tight, we might prioritize those, or they might not prioritize and just go as far as they can. The thing is that money could be coming in two different ways. Some of it may come through the regular CCDF channel, which is more the money follows the child somewhere, but there's also this opportunity to have grants to sustain operations that can't be fully open, and it wouldn't be necessarily a per child amount. It could be just looking at the gap between, you know, what it really costs to serve X amount of children and what you can get through fees and subsidies in some way to help make that up. So I think it's hard to know for sure, but we're really just not allowed to pay for teachers who are teaching. We can pay with CCDF for people who are supporting those children in remote settings. And we'll have that in writing pretty soon, but that's the direction that we're going right now.
I think that would be tremendously helpful, Shannon. I think that's one of the things we've heard most often from the field, right, is this concern about because of the language in the law that references the regular school day, not being able then to use child care dollars while that regular day is happening, even though, as we've said, right, it's not really a regular day. So kind of being able to hone in on that and recognize that there is really no regular day, that the days vary wildly from community to community, and that as long as child care providers are not providing direct instruction, that it's okay to use the child care dollars. I think that would go a long way in helping people right now.
Yeah, I think within a week we should have that out. I know, I wish we'd done it sooner. It's taking a little ways to get through our clearance process, but that is what we've done before. There's never been anything quite like this, but the closest to it. I think what's important to remember, though, is that our CCDF funds are traditionally very flexible, and that just because the federal law allows something doesn't necessarily mean that's what each state will choose to do. So we have to be mindful of both what's allowable at the federal level and what's chosen among those pieces as the state policy. That's a really good question. Exactly.
Thank you, Shannon. This is Aaron. I just want to raise one point that I think kind of ties to everything. I appreciate your guidance there, Shannon, is about the availability and usefulness of engaging the college student population who cannot go back to college in many places and want to work and be engaged and be continuing to be supportive. And I think our friends at the American Camp Association that do so well in hiring so many college students over the summer, and then they typically return. There are a lot of trained folks who are willing to keep working with young people who have experience, and they're more tech savvy than most. And so as you move into the digital learning space, they're not going to replace anyone, but they could be a support. And a good example, yesterday I talked to one of our award-winning programs, Breakthrough Collaborative National Organization. They had 85% to 90% attendance in their summer learning programs. It was very effective. And normally they would stop, and they're saying, well, we have all these folks. They want to keep going, and we have the curriculum, and we learn. So how can we keep, utilizing practices like that?
So there was another
there's no anything to keep us from doing that, but there may be, depending on where they want to work, there may be a little bit of background check hurdles or a few things they have to do. Some of those are states got waivers on different pieces of that, so still going to be a little bit of individual state differences, but I think that that's the kind of thing that you should be able to work with your state administrator and the licensing officials in your state by state to try to come up with something that works.
So there was another question that was about smaller organizations, that the perception was that larger organizations have a better ability to kind of secure funding from the state, and any recommendations from all of you about how smaller organizations can be equally a part of the distribution of funds?
We're pushing very hard to make sure that the funding is available to the whole spectrum of providers and that we maintain family choice and a mixed delivery system. And we've said that a lot. I think that there's a little bit or more, sometimes a little more than a little bit of problem around the business acumen of the people who might be trying to apply for funds. And what I would say is that they look at what was needed in order to access the funds before and try to think about, are they ready? Can they talk about their fixed costs and their flexible costs, and do they have a checking account, and are they thinking of themselves as a business? Have they looked at how many hours they put in and how many children it takes to break even and then make a little bit of a profit, and if their costs are changing, so that they can articulate whatever they need to when the applications come down the pike, which we have not seen yet because the laws haven't passed. But also the Quality Center, your NCASE counterpart, does have a lot of business training that we're hoping to be able to scale up that would help smaller providers be able to get some of this training. I know we'd have to get it out fast, but there are some already in place, and there are things that that they could get now. So maybe we need to try to get that information, find out where it is online, and try to get it out through you all to whatever your networks are, so that they can start thinking of themselves as businesses. They sometimes if you don't have a checking account that keeps your business costs separate from your home costs, and you've not really separated them out. And I think that what we heard recently is that most of the childcares don't think of themselves as small businesses, the really little ones. And that gets in your way if you're trying to go after funding for your small business, if you don't kind of have that mindset.
Mm-hmm. Jen, I'm assuming it's a critical time for any of these organizations to be networking with their state after-school network. It seems like they would play a critical role.
Yeah, I think that's right. I was going to lift up sort of a parallel example, I guess, which is when the payroll protection program, when that whole piece first came out, one of the key things that many of us in the field and the networks in particular helped do was provide training to after-school and summer providers throughout their states on how to apply, like down to the level of like, here's the number you should be looking for to fill in line 7 of this form. So I think that model could be expanded on if there are other kinds of funding that we can identify that really could be supporting some of these programs that just will need some help in actually executing the paperwork and using the right language to make that happen.
Yeah.
So believe it or not, we're down to just a few minutes. This has been a fantastic conversation. Shannon, any last suggestions or prompts to attendees as we wrap up?
I think if you're not getting the answer you want, make sure that the answer that you got was right. Ask the same question of multiple people. Go up the chain, try to find the most authoritative source you can. It sounds like you've got great after-school resources through the group that's speaking here, but if it's a CCDF thing, you can always get in touch with us, Office of Child Care, and we can help you or your organization figure out anything about the flexibilities. We have a really good website where we put updated FAQs, frequently asked questions, all the time. That's where the school-age stuff will go. All the flexibilities that are currently in the law, everything about that is on our Office of Child Care website. So if you just look at like HHS, Office of Child Care, it should come up, and then the front page is a cute little girl washing her hands, getting help from a teacher. Right next to it, it says COVID resources, click here, click there, in you go, tons of information. So,
well, and I think we even have a link to that. Preeti, if you could bring the PowerPoint back in.
That'd be good, in case I didn't describe it quite right.
There it is. There's the link to the Office of Child Care COVID resources, as well as some of the other links, certainly to our presenters today. I want to thank our presenters for sharing your perspective. Again, it's been a summer like no other, but it's exciting to see our field still thriving. As Shannon said, NCASE is here for you and with you, so feel free to contact us. Here's the contact information for NCASE, and please feel free to write us with your needs. Again, the presentation is there to download if you're interested in it, or we'll be sending it out to attendees afterwards. And again, thanks to everyone. This has been a wonderful conversation, and